Hello, my name is Joel Strauss, Health Officer with the Bay County Health Department, and today is Tuesday, February 9th, and here's your weekly update for COVID-19 and the status of COVID-19 vaccine here in Bay County, Michigan. While the number of confirmed cases have dropped significantly since November and December, that decrease has currently plateaued, however. The test positivity rate is currently under 5%, which is a good thing, but it's not dropping to the levels that we saw in September and early October. With the opening of bars, restaurants, and sporting venues to a lesser extent, it's important to reiterate the important factors that are stopping the virus and that we have been using since March of last year. Mainly distancing, wearing a mask, using good hygiene, and keeping an eye on symptoms. This is especially important as it seems that new variants, particularly the UK B.1.1.1.7 variant, is doubling every 8 days. And as we've noted on previous videos, this variant is extremely contagious and may cause more serious health issues in seniors and persons who are immunocompromised. Unfortunately, due to shortages at the state and national level, we're still not seeing increases in supply provided to the Bay County Health Department. In fact, we expect that for the coming 3 weeks, the Health Department will provide on average 1,000 first doses and 1,000 to 2,000 second doses per week. We hope that the supply chains at the state and national level will dramatically increase, and we will continue to advocate for more vaccine supply to Bay County providers as well. The UK variant, or B.1.1.1.7, has now been reported in 4 counties here in Michigan: Washtenaw, Wayne, Kent, and Kalamazoo. We expect that it will widely spread throughout the state in the coming weeks, and there are some indications that it will be the predominant strain in Michigan in the coming months. As we noted earlier, this strain is highly contagious and may cause more serious illness in immunocompromised persons. We need to continue to do the basics to stop the spread of the virus. Wearing a face mask around others, staying 6 feet apart from others, washing our hands often, and ventilating indoor spaces. Finally, if you are having symptoms that are associated with COVID-19, please isolate yourself and distance from others, and seek testing as soon as possible. In the past weeks, we've heard a ton of reports from concerned citizens anxious about getting the vaccine as soon as possible and wondering if they're registered and when they will get the vaccine. Often you may hear anecdotal stories about family, friends, or acquaintances getting the vaccine on short notice from the health department or different providers in the community or communities outside of Bay County. While there are some instances where persons who are able to obtain the vaccine on short notice, most of these stories aren't true. In fact, many persons who have registered with Bay County Health Department, McLaren, or Myers, or other pharmacies are still waiting to hear if their registration was accepted and if they are eligible to obtain the vaccine. While vaccine wait lists are long here in Bay County and throughout the state and throughout the United States, the supplies that we have are being used to its fullest capacity within the week they are delivered. So why doesn't Bay County have a comprehensive registration and scheduling system? One where providers could share the information and determine who needs to be vaccinated and who can be scheduled. Well, there were no decisions to have a coordinated, unified scheduling system at the national level, and unfortunately, the idea was not employed at the state level either. So you have 83 counties in Michigan with 83 different registration and scheduling systems layered on top with different registration and scheduling systems from other hospitals and pharmacies. And unfortunately, due to corporate policies and privacy laws, most of this information cannot be shared. But we're doing our best to coordinate with other providers in Bay County and the surrounding region. And as we have previously mentioned, the registration and scheduling process here at the Bay County Health Department is constantly being improved and made more responsive to our residents' needs. This week, we will begin to employ a system where identified individuals will have their registration confirmed and can choose their vaccination times and dates electronically as the vaccine becomes available. If you have the opportunity to obtain the vaccine from another provider in the community, you may call and leave a message on our COVID-19 hotline at 989-308-1828, or you can send an email to bchd@baycounty.net with the words "cancel my appointment" or "registration" on the subject line. In the body of the email, please include your name, your date of birth, and your phone number so we can cross-reference your registration and update our database. This concludes this week's update. Please check the county website, the Bay County Health Department Facebook page, and this particular YouTube channel for more and frequent updates on a daily basis. Thank you and have a good week.